Thanks, Ziv. I got a call yesterday. Patient saying she's having sensitivity, chipped a tooth. Take a selfie, send it to me. I'll check on it. It's a class 5 that chipped. If she doesn't touch it, nothing's gonna happen. So we told her to hang in there as things get clearer, and we'll attend to it. But when she called, she was very concerned about it. Understand that people they can overreact about things. One thing that I did after seeing so much polarization online, I actually started talking to my patients. I'm like, there's a chance that you can contact corona if you come in at this time. Given the emergency that you are in, would you still go through with it, or just try to avoid it and take antibiotics? And what they told me is that there is no way they could have waited another day. So they will still go through with the emergency, even if there is a risk to contact corona. Others might answer differently, but the 3 patients I asked, given their emergency situation, they're like, get me out of this pain. So there's also a subjective level of how people perceive pain and deal with it, and what risks they're willing to take. And our job is to just educate them and to be safe. Would you agree, Ziv?
Yeah, I mean we have to, our mind, and including myself sometimes, our mind is full of chaos because we are bombarded with so much information, very often conflicting. We are dealing with crises in our personal life, our financial life, our practice life, and there's so much information, so it's easy to get confused. But if you kind of take a step back and you take a deep breath and you just think with full clarity, it's not that complicated. It's not that complicated. Any patient that calls, you want to spend some time on the phone with them and figure out what is bothering you. I gave you a list of about 10, 20 questions you need to ask them. Through these questions, you will get a hint. You will hear the diagnosis, almost 90%. You'll know what's going on. And then it's about you communicating what is the course of action. The one thing that I don't love is when we tell the patients, listen, I don't know. I don't know many things. I don't even know what I don't know. And there's so many things that I don't know. But you do know. When a patient calls you with an emergency, with a particular problem, you're a dentist, you're a licensed dentist or a specialist, you know how to diagnose. So go through the diagnostic process in your mind. Don't tell the patient, I don't know. You can tell the patient, it's very likely that you have A, B, C. It's very likely because you have periodontal disease, very likely that you develop this abscess. Remember, we treated it 2 years ago. It's probably happening again. And this is what I recommend. And this is what's going to happen. This is how we're going to intercept it. Why? Because you should not come here. Not because I can't see you. I'm available and I will gladly see you, but we are seeing true emergencies. And what you're presenting with is not a true emergency. I know it feels like it to you. And this is what I recommend. So be very clear when you talk to your patients and spend the time. And the patients that are hysterical and panicky, you can calm them down. Just more time.